So I just want to show one other example, and this one is a case report for a patient who had an adult with more mental health disorders, ADHD and anxiety. And she also had exposure to water damaged buildings and concern for mold related illness. And she had gotten genomics. And if we go back and look and say, well, what does that show? In her case, we were looking at the mental wellness panel. You would think, okay, ADHD, let's focus on attention and focus and anxiety, because she had anxiety, maybe medication responses if you were going to do medications. But the panel gives you a lot more information. When we look at attention and focus, she had one gene variant that does impact focus, and it leads to higher glutamate, which we said is this excitatory neurotransmitter. It affects several other things down the line, but it's not like she had a ton of things that were abnormal. If we go and look at what are the factors that might contribute to an increased tendency for anxiety, there were a handful of things. These aren't super rare. I expanded this up to anything less than about 20% of the frequency. And there's one gene that was related to estrogen receptors, because you need estrogen to help dampen an anxiety response or turn it down. And if you can't receive that signal, it can impact things. She had a tendency to overproduce adrenaline and a tendency for lower serotonin. So we figure out, all right, we want to address those, but they're not super rare things. So is that accounting for everything that's going on in this individual? And then when you look at inflammation, there were numerous hits on numerous levels. That TNF alpha gene that we talked about beforehand came up again. And this is, again, less than 1% of the population. She's got 2 copies of it and way overproduces this inflammatory cytokine, but she's overproducing all sorts of cytokines. And she has difficulty shutting down inflammation once it's been triggered. So if that's the underlying genetics in a patient who then gets exposed to mycotoxins or whatever, like whether it was food sensitivities, in her, it seemed to be mycotoxins, then she's going to have this really exaggerated response. And so how do we customize a plan to treat for her? And if this was the kind of results that I would get, I would think, yes, we want to do something to support serotonin. 5-HTP is a precursor that can help support that. We want to address cortisol, which is a stress hormone, and GABA, which is that calming hormone. And ashwagandha, which is an herb, has been very helpful in that, and has been used in numerous medical traditions. We talked a little bit about hormone balance, and it would depend on the woman and what was going on. But then I would be leaning heavily into anti-inflammatory approaches and to addressing the root cause of that inflammation, which in her case we think was mold. Right? We would have done a more history, and we'd be looking at food sensitivities and gut health and everything. But I feel like this gives you a roadmap to know where you're going, what you want to treat. And that allows you to get to a much more precise set of interventions. All of this ends up being very actionable, because getting a test that just says, by the way, you're going to get Huntington's when you're older, that may not be the most useful test. But if you get a test that tells you this is a weak point, but here's the treatment, or here's the potential treatments, then it's really useful. I think that also can help minimize the trial and error approaches and help to get some better outcomes. So I just want to